Thank you, sir. I thank AIOS for giving me this opportunity, and I'll be talking about how to create a good sclerocorneal tunnel. Like ma'am said, that creating a good tunnel is relevant in SICS. And without going into details, I would like to tell that the parameters which are important for structural integrity of tunnel are the self-sealing property which makes it unique. And a poorly constructed tunnel can be a source of irrigation, astigmatism, hemorrhage, corneal trauma. So it is SICS is a safe, simple, consistent, stable, and cost-effective way of cataract removal. But small incision is a misnomer because the external incision is larger than the internal incision. And a quick recap of the surgical nimbus, I would like only to emphasize that everybody knows what surgical nimbus is, that the incision should be given behind the mid-limbal line to avoid the trauma to the trabecular meshwork and to avoid DMD. The wound construction should be, I've divided into 3 parts: the external incision, the sclerocorneal tunnel, and the internal incision. The external incision should be created with a Ball-Parker knife or a disposable green plate, as we all do it. The location, shape, strength, length, and depth matters. And the astigmatism neutral funnel should be kept in mind while we create the external incision, and the ideal distance should be around 1 to 2 mm. So the length of the incision, it should vary from 5 to 6 mm for cortical cataract, and in case of compromised corneal endothelium, a large incision size may be made. So the primary deciding factor in the length of the incision is always the grade of the cataract as well as the size of the nucleus, and not the size of the IOL to be implanted. So the external incision, an optimal depth, as the length is important, the optimal depth is also important, and its thickness should be around half to 2/3 of the thickness of the sclera. Anything less can lead to a buttonholing, and anything which is deep can lead to a premature entry and a ciliary body damage. So the sclerocorneal tunnel, the sclerocorneal tunnel, the shape, the length, the width, the depth, and the side pockets are important. The central shape should be almost square with a corneal instruction, a limbal width, and a scleral pocket. And then there should be side pockets. These are the side pockets that give us the edge, and a larger nucleus can be taken out. So a diamond or metal crescent disposable knife has to be used. We hold the eyeball, we propagate anteriorly until it engages the limbus tissue. The crescent has to orient in upward and forward direction. And when we go into the cornea, the blade should be it should be held up. So there are 2 movements, the tadpole movement and the swiping movements. The tadpole movement causes the lamellar separation, and the swiping movements cause the cutting. The internal aspect of the tunnel is about 25% larger than the external incision, which gives us the edge. And the internal incision, when we make the internal incision, the entry should be very important. The entry should be sideways, and the dimple down technique should be used. So how should be an ideal SICS tunnel? Its location should be 1.5 to 2 mm from the anterior border of the limbus. Its depth should be between half and 3/4 of the thickness of the sclera, and the internal corneal lip should be around 1.5 mm. So the aim at the end of the day is to achieve a self-sealing, astigmatically neutral wound. So I have a video. Could you play the video, please?
This paper may be ready on the other side.
Dr. Purendra Bhasin is there?
So here the incision is created with the blade, and just the weight of the blade is given, and we with the crescent we revise it, and then we go forward with the tadpole movement and create the lamellar separation, and then we swipe sideways, the swiping movements, and create the cuts, and then we dissect the side pockets. The internal incision should be, the keratome should be entered sideways, and a dimple down technique should be used, and a forward anterior cutting should be used. I have another video. This is the same video? No. Yeah. So I have another video where the lamellar separation can be created in 3 quadrants, and then the sideways cutting can be done. So here the lamellar separation is created in the center, and then in the two pockets in the lateral extreme, and then these three are joined, and the care should be taken that the plane should be similar. So for the beginners, it is very easy to create a lamellar separation in the three quadrants, and then with care they can join the three lamellar separation.
But
They may be at different planes.
At the end, it may be
Yeah.
different plane and causing more of astigmatism.
Because
It
the-
may
I'm
be,
just,
sir,
I'm
but
just
it is,
suspecting. I don't do
it's just-
SICS. I can't do.
But for the beginners, it is a bit easier.
Okay.
Chalo.
Thank you.